What if I told you that one of the most transformative medical inventions of the 20th century was not a pill, a machine, or a surgical tool, but a tiny, transparent disc you place directly onto your eye? For centuries, humanity struggled with poor vision, trapped behind heavy, fragile eyeglasses that defined appearance, limited activity, and carried a quiet social stigma. The idea of a lens that could sit invisibly on the eye lingered as a fantasy, from Leonardo da Vinci's 1508 sketches to the clumsy glass prototypes of the 1880s. But it was not until mid-20th century America that this fantasy became a safe, mass-produced reality, a revolution built on painstaking experimentation, corporate courage, regulatory courage, and the quiet obsession of a handful of American optometrists and scientists. This is the unflinching little-known history of the contact lens, an American innovation that redefined vision freedom and what the human eye could bear to see clearly. Long before modern plastics or precision manufacturing, early contact lenses were brutal, dangerous objects. In 1888, German and Swiss pioneers crafted thick glass scleral lenses that covered the entire visible eye. These devices were heavy, unforgiving, and could be worn for only an hour or two before causing extreme pain, corneal irritation, or even infection. Patients tolerated them only as a last resort, and they remained a niche medical curiosity for nearly 50 years. Glass was too rigid, too heavy, and too unyielding to conform to the delicate curvature of the human cornea. The world waited for a material that could change everything, and that material arrived in the United States in the 1930s, polymethyl methacrylate, better known as PMMA, a lightweight, shatter-resistant plastic that would launch the first real contact lens revolution. Enter William Feinbloom, a New York optometrist whose name is etched into the foundation of modern vision care. In 1936, Feinbloom introduced the first American-made contact lens, a hybrid design, pairing a glass central optic with a plastic scleral band crafted by the Bakelite Corporation. This was not merely a small tweak. It was a paradigm shift. Feinbloom's lens cut down weight, improved fit, and extended wear time from less than an hour to nearly 4 hours, a staggering leap for patients who had known nothing but discomfort. Feinbloom's innovation faced immediate pushback from traditional eyewear manufacturers who viewed contact lenses as a threat to their lucrative eyeglass monopoly. Skeptical doctors dismissed plastic lenses as unsafe, and many optometry schools refused to teach fitting techniques. Undeterred, Feinbloom opened the first dedicated contact lens clinic in New York City, where he treated patients rejected by other practices. His work proved that plastic lenses were not just viable, but life-changing, forcing the industry to confront a future where glasses were no longer the only option. He patented his design, traveled the country, teaching fellow optometrists how to fit these lenses, and laid the groundwork for American dominance in contact lens innovation. Yet even Feinbloom's hybrid lens had limits. It still covered the sclera, the white of the eye, and remained bulky, fragile, and out of reach for most Americans. The next leap required someone bold enough to shrink the lens entirely, to abandon the sclera, and focus solely on the cornea, the clear front layer of the eye, where vision truly begins. That visionary was Kevin Tuohy, a California optometrist who solved the puzzle in 1948. Tuohy's breakthrough was deceptively simple. He created the first corneal contact lens, a tiny PMMA disc that rested only on the cornea, not the entire eye. This microlens design was smaller, lighter, and more stable than any predecessor. It stayed centered during blinking, required no buffer fluid, and could be worn for up to 16 hours a day. Overnight, contact lenses shifted from a rare medical device to a practical alternative to glasses. Tuohy's corneal lens became the first mass-appeal contact lens, fueling a post-war cultural shift as veterans, professionals, and young people embraced the freedom of invisible vision correction. By the 1950s, American optometry offices were flooded with requests for Tuohy's lenses, and a new industry was born, complete with lens insurance plans to cover breakage, a sign of how quickly these devices had entered mainstream life. But the hard plastic PMMA lens still had a fatal flaw. It blocked oxygen from reaching the cornea. Long-term wear risked corneal swelling, inflammation, and permanent damage. Patients craved comfort, and scientists hunted for a material that could be soft, flexible, and permeable to oxygen. The key material came from Czechoslovakia in 1960, Otto Wichterl's hydrogel polymer FEMA, a water-loving plastic that was gentle on the eye and allowed oxygen flow. Yet, scientific discovery alone does not change the world. Commercialization and regulatory approval do. And that is where America stepped in again, turning a European laboratory breakthrough into a global consumer product. In 1965, Bausch & Lomb, the iconic American optical firm, secured exclusive U.S. rights to witch turtle's hydrogel patent. The company poured millions into refining the material, perfecting, manufacturing, and conducting rigorous clinical trials to meet the strict safety standards of the U.S. Food and Drug Administration. The FDA's role here cannot be overstated. It transformed contact lenses from unregulated experimental devices into medically approved consumer-safe products. On a landmark day in 1971, Bausch & Lomb's Solflens became the first FDA-approved soft contact lens in the United States and the world. The soft lens was comfortable, flexible, and far gentler than hard PMMA lenses. Adoption exploded, and by the end of the 1970s, soft lenses dominated the market, holding an 80% share that remains today. This approval was more than a product launch. It was a regulatory and industrial blueprint. America's combination of cutting-edge material, licensing, precision, manufacturing, and strict medical oversight created a model for global medical device innovation. The 1970s and 1980s brought wave after wave of American advances: rigid gas-permeable lenses in 1979, extended wear lenses in the early 1980s, and in 1987, Johnson & Johnson's FDA approved disposable soft lenses, which eliminated cleaning hassle and reduced infection risk. In 1995, the first daily disposable lenses hit the U.S. market, making contact lenses safer and more convenient than ever before. Each step bore the mark of American ingenuity, solving real human problems with science, scale, and strict safety standards. The cultural impact of the American contact lens revolution is immeasurable. For the first time in history, people with myopia, hyperopia, and astigmatism could live without glasses. Athletes gained unobstructed peripheral vision. Actors and public figures shed the visual stereotype of glasses wearer. Millions of people simply felt more confident and free. In 1964, President Lyndon B. Johnson made history as the first U.S. president to appear publicly wearing contact lenses, signaling to the nation that this invention was no longer a fringe choice, but a mainstream respected solution. What began as a fragile glass experiment became a symbol of human potential, proof that American innovation could turn a tiny invisible object into a force that liberated billions from the limits of poor vision. Today, more than 150 million people worldwide wear contact lenses, and nearly every modern lens traces its lineage to the American breakthroughs of Feinbloom, Tuohy, Bausch & Lomb, and the FDA. This is not a story of overnight success. It is a story of decades of failed prototypes, burned fingers, skeptical investors, and regulatory hurdles overcome by relentless curiosity. It is a story of how America took a centuries-old dream, wrapped it in plastic, and placed it gently on the cornea, changing vision, identity, and daily life forever. The next time you slip a contact lens into your eye, or see someone living freely without glasses, remember, you are witnessing the quiet thunder of an American revolution, one that remains invisible to the eye, but impossible to overlook in its impact. Please like, comment, share, and subscribe to the channel.